Welcome to the continuing series of South Florida Hospital News leadership videos. Today we are at a different place. We're not at a hospital. We're at Henderson Behavioral Health. And I'm sitting here with Steve RONIK, Dr. Steve RONIK from Henderson, and we're going to have a conversation about what behavioral health is today and get a little bit of background on Steve so you can understand what the behavioral health system is in South Florida, because they are a leading institution when it comes to behavioral health. Steve, welcome.
Thank you.
Good to see you here. And so let's start off and tell us a little bit about yourself and the position you hold here.
So my name is Steve RONIK. I'm the Chief Executive Officer here at Henderson Behavioral Health.
Great. And how long have you been with Henderson?
I've actually been employed at Henderson for about 30 years and I'm CEO for, it'll be 27.
Right. And Henderson, I understand, is coming up on its 70th anniversary of serving the community.
We're really excited about that. Henderson was founded in 1953, so this year we're celebrating 70 years of operations.
Wow.
Very proud.
Amazing, amazing. So tell us a little bit, people like to know a little bit about yourself, family, and so tell us a little bit about that.
Well, I've been a Floridian for a long time. I moved here in 1992.
That is a long time.
I grew up in Queens in New York City, and I worked for 10 years in a large healthcare system before coming to Florida. I worked it's called now Northwell Health, which is one of the largest healthcare systems in the world.
Right.
And I worked for the Zucker Hillside Division, which is the mental health division, which was an incredible privilege. I was there 10 years, and I can't think of a better place to have started my career. I was surrounded by some of the giants in the field, and I got attention and try to be like them, and it was a great beginning for me. So
that brought you down. Here in the early '90s. Actually, we were neighbors, I guess, growing up, because I actually was in the borough of Brooklyn.
Okay.
For a number of years, and left there in the early '70s. So tell us about your educational background. You hold a doctorate.
Yeah, I started, I went to high school in Queens, and then I went to college in Central New York. I'm actually a first-generation college graduate, first one anywhere in my family to complete 4-10 college. And I got my bachelor's degree at SUNY Oneonta, which was a great undergraduate state university. And then I got my master's degree in social work at Adelphi University, became a licensed clinician, and I only worked really as a clinician for a few years before gravitating into, beginning supervisory management roles in the first healthcare system I worked in. And I was fortunate to then pursue my doctorate in organizational leadership and graduate from Nova Southeastern University. I was on faculty there for almost 15 years. I was on faculty at Barry University for about 7 or 8 years, and I actually was on faculty at Adelphi, where I taught graduate school there for several years. So I teach at the moment, but it was a big part of my career for many, many years.
Were you teaching and working administratively at the same time?
So I always had, my full-time role.
Sure.
I've been in Henderson in this full-time capacity for a really long time. And I was always teaching graduate school. I taught advanced social policy. I taught organizational theory and behavior, leadership courses. Yeah, big interest of mine.
Did you think back then that behavioral health would be what it is today in our society?
Well, the last 5 years have been the best part of my career in terms of what's happened with mental health in our society. So when I started out as a young man and a new professional, there was still a lot of stigma.
Sure, absolutely.
So there was a lot of shame. It was hard to get people to talk about the fact that they had mental health conditions. Now, it's just, we really find stigma is at a minimum. People talk about the services, particularly young people are very free about talking about it. Celebrities have come out and talked about their struggles, which goes a long way because they have influence. And so it's just, it's now part of the American conversation. 1 in 4 Americans at any given time have a diagnosable mental health condition, so they're just super common, and people are very open about it, which is great.
Which is not the way it was, like you're saying, years ago. It was very, very different today. As your career progressed, what was some, and you've gone through a variety of different areas in in mental health and teaching. What were some of the, I'm not going to call them challenges, but learning moments during those years?
Well, I mean, I had a lot. You know, when I first started out, and you know, I became a supervisor at a very young age. You know, I got out of college. I was only 20 because I graduated high school. I was 16 and started college at 17, and I was out at 20. And so I had my master's degree, and I was a new clinician. I was like 22. So I was really a kid, a child, and I had tremendous challenges, I think, because I really wasn't grown up yet, and I'm in this position all of a sudden where I'm supposed to be helping people with their mental health conditions, and I was I was very serious about the work right from the beginning.
Sure.
But I think because I wasn't comfortable with myself yet, it took me a while to get that confidence. Very quickly, I moved into supervisory roles. And again, I was very young, and it took me a while to learn. But I just, you know, like a lot of my colleagues, I watched the really good ones and tried to be like them.
Kind of, and which leads me to mentors within, from your youth to where you are today. I'm sure you've had many. And what were some of those lessons you learned from the mentors?
Yeah, so I mean, right at the beginning, you know, and I tell young people about this, I had mentors who were immediate supervisors, and I had people who were just as influential who were not my immediate supervisor, but they were around. They were in the building. So I would, you know, pick out the people who seemed to me really have it together and know what they were doing, and I tried to be like them. And that's actually one of the things that worries me about remote work in a lot of organizations now, because especially for young people, if they don't get that time to see people and kind of learn, I can do it virtually, but somehow it's not quite the same.
No, it's not. Virtual is nice at some degree, but 100% is very difficult, I believe.
And of course, you know, Henderson is a healthcare system, so everyone is at work every day, right? Because we help people in person. With that said, Henderson does have telehealth capacity, and we see a lot of people through telehealth as well. It's another access point.
It's another access point to be able to help people who want to use that median to be able to get through.
What we have found is for people with complex mental health conditions, very often telehealth is okay, but maybe insufficient. And you always have to manage, you know, clinician convenience versus patient convenience, right? We're a patients first healthcare system, so that's what drives our decisions.
So when you got to Henderson, what role did you start off with at Henderson?
So I was really lucky, you know, I came to Henderson, and this state was getting ready to develop this model, without getting too technical, called assertive community treatment. And I interviewed for a position to be the first team leader of the first assertive community treatment team in the state of Florida. So that was appealing to me, you know, I wanted to learn, and it was my first job, and I did that for about a year. Then I got promoted to director of outpatient services. I did for a couple of years. And then I was, you know, timing is everything. I was fortunate, and a relatively young man stepped into the CEO position, and I'm forever grateful.
That's great. That's great. And it looks like you've built. And how many people do you have working at Henderson
We
now?
have over 700 employees at over 20 locations, mostly in Broward County, but we have a big presence in Palm Beach. We're in Palm Beach Gardens. We have a big presence in the Treasure Coast. We have 2 offices in Port St. Lucie, and we actually have an office in Brevard County now, in Melbourne.
Oh, really?
So we've grown north.
So you've gone into the Treasure Coast pretty heavily then?
We have a lot of stuff in both Palm Beach and the Treasure Coast, up to and including Okeechobee County too.
That's great. That's great. Tell me a little bit about the challenges that you see on a day-to-day basis here. And I'm going to make it like a 2-part. We all went through COVID, and it had to be very difficult for this organization to go through COVID when you really need to see people face to face, and had to switch to probably telehealth. Tell us, I guess, how that went and how you adjusted, and what good came out of it, changes in policy, changes in how you handle things that came out of COVID that made you maybe a better organization today?
Well, it's interesting. You know, I was in touch with my colleagues, people who do what I do all over the country throughout COVID, because this was uncharted territory for all of us. And Henderson, a lot of our colleagues switched completely to virtual at the worst of COVID. We never did. Like for example, I came to work every single day. even though my role is administrative, because I felt, you know, we have our residences open, our inpatient facilities open, our staff are coming in every day. They want to and need to see that the CEO is here every single day.
Absolutely,
you know, it doesn't matter if I can do my job remotely. I need to be here. So I was here. I never missed a day. And we stayed open every day. With that said, we had some capacity to do telehealth before COVID. One of the many things Henderson does is we do a lot of university student counseling. So Nova Southeastern University, for example, they contract out their student counseling center to Henderson.
Oh, okay.
We've been doing that for over a decade. Broward College does too. So for our NSU students, we were doing telehealth for some of the off-site campuses. They have campuses all over Florida. They have students in Puerto Rico. They have students all over the world. So for those students, we needed to develop a telehealth platform. So we were able during COVID to expand our telehealth capacity pretty quickly. But even during the worst days of COVID, we probably never were more than 20 to 25% remote, even at the worst.
That's one.
So patients came in, we had distancing, everybody wore masks, just like any healthcare setting that was open. We didn't have visitors. You know, it's a very, very difficult time for staff, for patients, particularly for our staff. You know, then we had the Great Resignation on top of it. That really hasn't gotten much better. Hiring people in all industries,
it's tough.
Not just healthcare, is very hard right now.
Very, very tough. How, I mean, I was talking a little earlier with one of your colleagues, and I didn't realize this, how many units, like independent care units, that you manage for individuals. So even during that COVID, you had people out there in independent apartments or whatever to be able to take care of. I mean, I mean, unbelievable task.
Right, because in addition to being an outpatient and rehabilitation organization, we're a big house. So we have about 200 units that we own and operate directly. We have over almost 400 more that are supportive housing units. We have a 48-bed, essentially inpatient unit, which is an integrated services facility, which is a CSU, a short-term residential treatment facility. It's a detox. So of course, those facilities are open 24/7 every day.
How did
you never close?
You never close. You never
and
close.
Henderson never closes. Right.
How was that? How did your employees react to that? I guess there was some.
It was hard.
It was hard. It was hard for them to understand, I think.
Well, I mean, everyone knows that. Everyone who works at Henderson feels a tremendous obligation to our patients, because we help all kinds of folks, but we essentially help people with complex mental health conditions, and we help a lot of people who are very underserved, vulnerable, and disadvantaged economically. So everyone knows what our obligation is here if they're going to work at Henderson. Everyone understands how committed they have to be to the patient experience. With that said, you know, working during COVID was tough. You know, people see colleagues in other organizations, they're all working remotely. Well, you know, we're a healthcare system.
Exactly right.
We're a different animal. And our staff were incredibly heroic, and I have just such gratitude to work alongside my colleagues. I feel very privileged.
What would you say for those who are going through school these days, going through their undergraduate, graduate degree, into psychology, into the mental health sciences, as I would call them? What advice do you give them in today's world differently that might have been maybe 10, 15 years ago?
Well, actually, this is probably the best time I've seen, particularly for licensed people. So for folks who want to be therapists, clinicians, whether it's a clinical social worker, a licensed clinical social worker, licensed mental health counselor, licensed marriage and family therapist, licensed clinical psychologist, from a career perspective, this is probably the best time, because there's a big supply and demand issue.
Sure.
Salaries have gotten much better. Reimbursement rates have slowly gotten better, and that informs salaries. And I think clinicians have a lot of choices now. So, and I mean, what's a more noble profession, you know, than healthcare? You know,
that's right, exactly.
And particularly the work we do at Henderson. You know, we're saving people's lives. You know, and that's not drama. It's the truth. So I'm very encouraging of people to go into healthcare. It's not easy. It's important.
Right. Have you seen with the, I guess, the advent of more people requesting and understanding the mental health, the behavioral health problems that they're having, the increased patient load for yourself over the last few years, especially coming out of COVID?
Yeah, demand is up. Demand is up, you know. We're seeing more emergency calls. One of the things Henderson does is we provide mobile crisis for the whole region. So 24/7, 365, we have mental health clinicians that are dispatched into the community to handle mental health emergencies. And that demand is up. Our CSU inpatient use is up. We're super busy. Luckily, you know, the federal government has instituted a crisis hotline, three-digit number, 988, and that's helped people. And we work in very close partnership with 988 because complex calls that come through get patched into us, and we go from there.
So you're a nonprofit.
We are
nonprofit, but nonprofits have to get money from someplace.
Right.
And people don't understand that. Profits at the end, they have the same business expenses that a for-profit company has. Just that they get their funding to be able to do things in a different manner.
Right.
How's your main funding? I think you mentioned earlier, but how's your main funding, and how can people help you?
Yeah, so we have multiple funding sources, and a nonprofit, just like any business, a for-profit, you know, has to take in more money than they spend. They have to have an operating margin, or you go out of business.
Right.
And the margins on the services that we provide are negligible. So it's a very, very hard business to run from a P&L perspective, because the margins are so small. In fact, for many of the services we provide, we lose money on. And that's where philanthropy comes in. We do look for philanthropy to offset that cost to help care for a very significant amount of uncompensated care that we provide.
And you have your own foundation too?
We don't have a foundation. So we do our development as part of Henderson.
Oh, okay.
We have a development department. We have a director of development. We're constantly raising money. We're in the middle, getting close to finishing a capital campaign, which helped pay for our CSU, which is beautiful, which opened over a year ago.
Now, do you, just because, again, I deal a lot within the healthcare industry, it's kind of all I do is the healthcare industry. Do you have locations or work with the hospitals within the South Florida market?
We have very close partnerships with all the hospital systems here, particularly with the 2 hospital districts.
Right.
We work very closely with Broward Health. We work very closely with Memorial Healthcare System. We also work closely with Holy Cross. We work closely with Cleveland Clinic. I just did a podcast with their CEO a few weeks ago. We have great respect for all of that. And, you know, not all the hospital systems provide mental health and substance use services. Right. But some do. Broward Health does, Memorial does, and we work closely with them.
Okay. So would you consider yourself sometimes with hospitals kind of like a post-acute situation with patients coming out?
No, we're both. So Henderson is also an acute care facility.
Right.
So we are a Baker. Our CSU is known as Baker Act receiving facility. So there's only 2 kinds of facilities that can accept involuntary mental health hospitalizations. And those are inpatient psychiatric units and crisis stabilization units. We have a crisis stabilization unit. They're basically the same. There are minor licensing differences, but they're almost the same thing. They look and feel like inpatient units. But we do post an acute episode. Henderson does much more outpatient and rehabilitation work than anybody else here in South Florida. Yeah.
That market locked up for yourself.
Well, there's a lot of competition.
There is.
And what we tell people, there's a lot of providers who do what we do, and at Henderson, we pay attention to the market, if you will, but we mostly pay attention to us to make sure that we're good. You know, we want to be the best, not for the sake of being the best, because we have an obligation to our patients. So everybody here gets that.
You do see a lot more organizations that I'm seeing now stepping into the space with not so much, somewhat, I guess, to face, but a robust amount of telehealth. I mean, they got these numbers. I mean, I even heard that there's kind of an XM station now, and I feel that they're just selling the wrong items to people and getting the wrong idea to people.
I think it is buyer beware. You know, COVID launched a significant amount of startup for-profit telehealth providers. And I'm sure some of them are good,
right,
but I think there's a lot that you probably have to pay very close attention to.
So if somebody watching this, what would, if you're looking for a place and you see all the commercials there for all these, I mean, they're on TV, they're on the radio, they're on XM, whatever it may be, what is something you tell people? What do they need to look for in choosing a place for a friend or a loved one or themselves?
Yeah, so I think, first of all, private practitioners for routine, uncomplicated health conditions. A lot of private practice practitioners are great. The thing is, for people with more complex mental health conditions, private practitioners typically can't offer a package of care. That's why they go to a system, with expertise like Henderson. But I think if you're going to go to a community organization, the first thing I would look for to see if they're accredited. If they're not accredited, that would concern. So Henderson has been continuously accredited since 1992 by CARF, the Commission on Accreditation of Rehabilitation Facilities, which is the preeminent accrediting body for systems like Henderson. And I think that's important. So I would look at that first and foremost.
That's great. And I assume you get a lot of referrals from physicians out there also.
We get referrals from everyone, physicians, from school, community, everyone. I mean, we have a walk-in center, for lack of a better word. It's called the Centralized Receiving System, and that's open all day, every day, 24 hours a day.
Wow.
People in all day long.
So kind of wraps up, because I know you have a busy day, and it's a Monday, is even more busy. So tell me, most CEOs that I've spoken to from the healthcare systems over the years, I always ask them this kind of final question of what's going on. What keeps you up at night? You're running a major healthcare system. It's not just, it's a major healthcare system. You got hundreds of employees. You got everything going on as a hospital does, but differently. They're different. What keeps you up at night? How do you sleep?
Yeah, well, I don't sleep well. I never have. But and what keeps me up at night is, I never take my role for granted for a single second any day ever. So I feel this obligation, to our staff and to our patients, because ultimately everything rests with me, right? But that's the job, that's what you signed up for, and I'm so lucky and I feel such gratitude. But essentially, I know that my role is to create a great company and to support and make sure we have systems in place to be a great organization. That's my job. And then the staff who provide the direct care, they need to feel supported. So we work really, really hard on being a good place to work, because we know fundamentally if employees are not happy, that'll be transmitted to patients in some way.
Absolutely, absolutely. Well, Steve, I appreciate you coming by, and it's great. We're actually over here at Henderson. I came by Steve's place. So if you have any questions, Steve, how can they reach your organization?
The best thing is just to go to our website, which is hendersonbh.org. They can call 954-463-0911. But if you go to the website, all the information's there. We're really, really easy to access and get a hold of.
That's great. So until next time, Steve, I appreciate you stopping by.
Thank you for having me.
See here, and we will see you at the next interview.
Okay,
Take care. Take care. Bye-bye.
All right.